good evening, and welcome to the next installment of Meet the Leaders, presented by the Greater Phoenix Urban League. We want to thank you all for joining us for today's program. If you are familiar with the program, at this stage, we pretty much have some standard procedures that we would like all of you to participate in to make sure that we get as many of our community members to the program and get this vital information. And of course, today we'll be talking about the COVID-19 vaccine, facts versus fiction. So if you are with us whether you're on YouTube or Facebook, please like, comment, share, let the world know that you're with us. Again, this is vital information that we are bringing to you today. We have an esteemed panel of doctors, well-informed on the COVID-19 vaccine, the history of medical activity within the United States, and how it has impacted the Black and African American community. So again, if you are on social media, if you're watching social media, YouTube, please like, comment, share. Let the world know that you're with us, and we'll get started with the program. In just a few seconds, again, like, comment, share. We will be taking questions from the audience. So if you have any questions that's been bugging you, if you have not been able to get some trustworthy information, today's the opportunity to do that. We have a couple of we have Dr. Allen, Dr. Wethers from Banner Health and Blue Cross Blue Shield, respectively, along with Mr. Robert Young, who is well entrenched in the Phoenix community and will be able to give some great insight on some of the thoughts that community members are having regarding COVID-19 and the vaccine. So again, like, comment, share, let the world know that you're with us. Feel free to drop in the comments. Let us know what part of the Phoenix Valley you are calling from. Those of you who are joining us from Clubhouse, we are broadcasting on Clubhouse as well. It's a brand new social media that is taking up a lot of attention over the past couple of weeks. So we're doing everything that we can to reach to every facet, every layer of our Greater Phoenix community for this vital information. So we are quickly approaching a full year of COVID-19 virus. And while it may not be the top news stories in the news cycle right now, it still poses a threat to all of our lives, industry, and our way of life. To date, there have been over 22 million infections, quickly approaching 400,000 deaths. And unfortunately, what now has become typical is affecting the Black and Brown communities disproportionately. However, help may be on the way. And we're here to talk about that COVID-19 vaccine and see if this is indeed something that's going to help fend off the COVID-19 virus. Now, without any further ado, I would like to introduce the president and CEO of the Greater Phoenix Urban League, George Dean. Take it away, George.
Good evening. I'm George Dean, the president and CEO of the Greater Phoenix Urban League, and I first want to say Happy New Year to all of you and welcome to our first Meet the Leaders virtual forum of 2021. We started these forums in June 2020 and plan to keep them going throughout 2021, usually on the first Monday of each month, subject to change as this one has been because of various circumstances and so forth, but we'll let you know in advance when those do change. The COVID-19 virus has now been with us over 10 months, and from all indications will be with us for a time. It is expected that it will not be eliminated, but we will be able to control it with the vaccines that have been developed and the vaccinations that are taking place. There are reported over 375 deaths in the U.S., and in Arizona, over 10,000 has died. There are reported over 600,000 cases in Arizona, with almost 400,000 of those cases right here in Maricopa County. Hospitals are experiencing a surge within a surge with signs of worse weeks ahead. The vaccines are safe and plans are ongoing to get people vaccinated. The point of mass vaccinations is to achieve herd immunity, in which the majority of the population is protected against COVID-19. We're very pleased and thankful this evening to lead the discussion On the vaccine and vaccinations, we have Dr. Darren Wethers, Blue Cross Blue Shield Arizona, Vice President of Clinical Operations, Dr. Angela Allens, Clinical Research Program Director for Banner Health, and Dr. Robert Young, a Board of Directors member for Tanner Community Development Corporation. Stay tuned and remember, listen closely so that you can get vaccine and be safe. Stay safe, stay safe, stay safe. Okay, Jerry, back to you and to the panel.
Thank you, President Dean. Once again, as always, I'd like to thank you for your leadership in the Greater Phoenix area, as well as the Greater Phoenix Urban League. Now, without any further ado, I would like to get to our panelists who will be joining us today. Again, when I tell you we have an esteemed, qualified, well-informed panel, that's precisely what we have here for you today. So first, I would like to introduce Dr. Angela Allen.
Yes.
How you doing? Dr. Allen has a Doctor of Philosophy from Arizona State University, College of Nursing and Healthcare Innovation. Educational specialties, a Master of Arts in Teaching and a Bachelor of Science in Nursing. She is also certified in rehabilitation and research. Dr. Allen is currently working in the community, addressing issues in cultural diversity, COVID-19, and research within the minority population with community programs such as AZ Community Engagement Alliance Consortium and the NIH All of Us program. Dr. Allen, welcome to the program.
Thank you very much, Jerry.
Next, I would like to introduce Dr. Darren Wethers, MD, and as well as a CPE. Darren is Vice President of Clinical Operations at Blue Cross Blue Shield of Arizona, where he oversees the full-time and contract positions, leads the Medical Management Committee, serves as the Senior Clinical Officer for URAC, and I'm sure we're going to learn what that means, and the physician representative on the crisis management team. Prior to entering this role in 2019, Dr. Wethers spent 4 years as the Chief Medical Officer for Blue Cross Blue Shield Arizona Advantage and 4 years as the Medical Director at Coventry Healthcare and Aetna, and practiced internal medicine for another 20 years. Dr. Wethers, welcome to the program.
Jerry, thank you for having me. Happy to be here.
And last but not least, I would like to introduce Mr. Robert Young, who is currently a member of the Board of Directors for Tanner Community Development Corporation and formerly the Interim Executive Director for the same organization. Prior to serving as Interim Executive Director, Mr. Young was a Programs Director for Tanner Community Development Corporation. Mr. Young, welcome to the broadcast.
Thank you so much.
So each of you, I know I tried my best to give you a proper introduction. So I would like to kind of give a moment, kind of reintroduce yourself to the audience and let them know, as of today, your connection to COVID-19. And we'll start with Dr. Allen.
Absolutely. Thank you very much, Jerry, for that introduction. And you did a well job, so not to worry. Part of my job as a clinical research program director here at one of the largest healthcare systems in Arizona is actually involving myself in not only the clinical aspect, but the community aspect. So I am primarily focused on the connection. Unfortunately, with the clinical aspect, we are seeing a high number of cases coming into Banner Health. And so my goal and part of my job is to inform the community, particularly those in the minority population, because we've seen such large numbers, on the relationship of COVID-19. I've been doing this since the secession that we began COVID-19 back in March, developing programs throughout the community, not only in the organizational areas, but also in faith-based organizations, as well as educating people currently through what we call the SEAL program, which is actually the Community Engagement Alliance League, which is led by several organizations such as Mayo Clinic, Arizona State University, U of A, and NAU. So collaborating with the two entities, the clinical and the community aspect, has allowed me to not only learn a lot about the virus, but also how it impacts our community. And last but not least, you'll hear me talk a little bit about all of us research and how it is so important that we learn about the diverse outcomes of various communities and how we can prevent certain areas as it relates to diseases and viruses as we have seen now. Thank you.
Dr. Wethers?
Jerry, thank you. I'm a general internal medicine doctor by training. Internal medicine doctors are one of the primary care providers for adults. In that regard, internal medicine doctors help take care of infections. And COVID-19 is certainly one of the major things that we've had to confront in the last 10 to 15 years. Probably nothing this major has impacted us since hepatitis C and before that HIV. It's truly the defining disease of our generation. At Blue Cross Blue Shield, I help to oversee the medical benefit. So in that regard, we decide what's going to be covered, how it's going to be covered, what's effective, what's still experimental, and try to meet the needs of the community as they present themselves. We want to make sure that everyone who needs to be tested is tested and tested with a proper instrument. We want to make sure that everyone who's eligible for a vaccine gets that vaccine without a cost burden. And we've just recently partnered with the Arizona Department of Health Services in their 24-hour, 7-day-a-week vaccine blitz that's taking place out at State Farm Stadium. The opening day for that was today, and we'll be running for at least the next 8 weeks.
Thank you, Dr. Wethers, for that vital information. And I know we're definitely going to unpack the cost and logistics involved with the vaccine. So we're looking forward to that part of the discussion. And Mr. Young?
Yes, thank you, Jerry. Well, I started out my career actually as a research chemist working for Eastman Kodak Company. And upon retiring, I came out into the community. I wanted to do some other work, and I was really interested in working for not-for-profits to see if we could not help the conditions that Black and brown people were experiencing, particularly in the area of health, education. And so I joined the TCDC organization, and we had a strong emphasis. One of our pillars was health equity. And while in the role as executive director of TCDC, we formed a health equity roundtable, and we were looking at what were the social determinants of health that were preventing our people from getting the kind of support and assistance they need to lead viable lives. And so we formed the roundtable, and in that work, we discovered that the Black and brown populations usually were the ones most vulnerable when any disease happened. And so we wanted to look at how do we look at this whole issue through the lens of health equity and through justice. And that determined the work that we're doing now. And we've been doing quite a bit of work collaborating with the various organizations around the city, trying to discover the strategies that we needed to implement into the communities most vulnerable.
Thank you, Mr. Young. And again, that topic, how the vaccine is and will be perceived, obviously is of vital importance. In order for any sort of test or plan to be effective, it needs to have the confidence of the people involved. So we're going to dive into that a bit. If you are watching in the audience, we are going to try and make every effort to dispel any myths, identify any information that may be fiction, and provide support for anything that may be factual. Ideally, we know that in order for, as I just mentioned, this vaccine to be fully effective and fully embraced, it needs to have the confidence of the people involved, have the confidence of the community, and hopefully the doctors before us will be able to help provide you that information. If you are in the audience and you have any questions, if you have some information that you need fact checked or that you're unsure about, feel free to drop it in the chat. We will address that throughout the course of the program. This is why we are here today. So with that being said, I would like to start with quite simply and as briefly as you can explain what is a vaccine. We know that the vaccine is supposed to be the solution to ending or getting COVID-19 under control? Or in fact, what is a vaccine from a medical perspective? Dr. Allen?
Sure. A vaccine is made up of various synthetic items that I would say that would align similar to what your body would consider receiving, I would say. And I'm going to let Dr. Wethers go into detail because I'm the data person. But it's pretty much, it's not what we've perceived it as a myth of body parts from various organs or infants, if you will. But it's a synthetic makeup of certain areas of the body, or excuse me, of a similar to the body that is aligned so that it can protect the body from anything that occurred. We have what is called a natural immunity. With the vaccine, it's a synthetic immunity that builds up the body. What it does is it aligns with the T cells and the B cells so that they can protect the body from having any type of virus.
And Dr. Wethers, it sounds like you might be well equipped to maybe add on to that or kind of dive a little deeper.
Dr. Allen really laid the groundwork for me, so she made it easy. I would describe a vaccine as something that stimulates our immune system to react. In some cases, in the cases of some vaccines, it could be a live virus. In this particular case, it is not. There is no component of COVID-19 that's live or inactivated that is being administered to people. What they did was to take the protein core around the virus, and just that portion of the virus then is made into a substance that is then injected to help our body recognize COVID-19 if ever we come in contact with it, so that our body will fight it off. It's not something that is harmful to our body. Some people may have some initial side effects when they first get it, but those side effects are our body responding to what's been administered and beginning the process of building the immunity to that foreign substance.
Thank you, Dr. Wethers. And as you saw, that was actually the question that we was going to get into. Is there's the belief that you are actually being injected with the virus, and that may somehow, actually lead to you getting COVID-19 versus fending it off. And as you just mentioned, in this vaccine in particular, that is not the case. Is that accurate?
That's very accurate, and such an important point for us to make. No one can catch COVID-19 by getting this vaccine. Another important point that we need to make is that no one will have a positive COVID test because they received the vaccine. There's no element of COVID-19 that would be triggered by this vaccine being received.
So we know that so I guess to reiterate, and again, knowing that we are here for fact versus fiction, to clarify what's real and what's fake, you will not get triggered. Having the vaccine will not trigger a positive test, and then there's no live virus included in the vaccine, and that cannot possibly give you COVID-19. For those of us who, and I guess we'll start with those that are afraid of the vaccine or don't want to be the first to get it. There are other precautions that you can take to avoid getting COVID-19, right? So one of them has been a mask. The other one has been sanitizing hands and the like. After someone's getting vaccinated, after someone actually gets vaccinated, will they still need to uphold those same measures to slow down the spread of COVID-19?
I would answer that. Absolutely. One of the things, and I have to, I adore Dr. Fauci's response when he shares that information. As mentioned, and thank you to Dr. Weaver, the vaccine, when it's given, again, the T cells, B cells are actually being activated. There's another cell called the memory cell that remembers this particular vaccine. Because this is such a new vaccine, we are unsure whether this vaccine is still going to combat an individual from having COVID. You also have to remember that there are timelines So when a person gets that first dose, which is called the booster dose, if you will, that's the dose that they are actually initially getting to determine whether they are, obviously receptive. They're going to get a second dose, perhaps depending on the type of vaccine. If it's one particular vaccine, which is Moderna, they'll get that dose in 4 weeks or 3 to 4 weeks. If it's the Pfizer, they'll get it in 2 to 3 weeks. And so within that time frame, they still ask that you maintain safety while wearing your mask and washing your hands and being socially distanced from individuals, because again, we're not aware or sure that will cause a person to not come in contact with having COVID. We've heard the myths, and that's why we're here, where people have gotten the vaccine, even both dosages, and still have gotten COVID. It could have been because they've had COVID before, because it's not required that you have to get tested prior to the vaccine. Or again, the way their body received, the T and the B cells reacted, the memory cells reacted to the vaccine, there's a possibility that they have. And that's very low in percentage when it comes to the outcome. So yes, we do ask you to continue to maintain CDC safety rules.
And Dr. Allen, you just mentioned that there were two vaccines and with varying time frames. So can we hear a little bit more about these different vaccines and maybe some of the nuances between the two?
Sure. So there are two different types of vaccines. There's Pfizer, which we've talked about, and I mentioned that there's about a 95 or so percent accuracy. And then there is also Moderna, which is actually close to the same percentage. Pfizer was the first vaccine that had come out, and that's why many people are more familiar. Following that was the Moderna. Both are actually vaccines that require 2 dosages. And again, that's the rationale behind that dosage. I myself, and I share this with everyone, have already received my first dosage. That does not mean that I'm out of the line of fire. I again await the second dose, and that was with the Pfizer, which I get in 3 weeks. There's differences when it comes to temperature, maintaining the temperature of each. There's differences when it comes to, again, how it's received, when it's received, the outcome, as well as when an individual should and should not see any type of changes. So again, they are very similar, and that's why it's not a huge issue when someone said, I've had Moderna versus Pfizer, but it's just the type of the vaccines, who developed them, as well as when you're receiving them. There's a third vaccine that they're working on now called AstraZeneca, and that is actually in its testing stage. And it is expected for that vaccine to come out late April, primarily because of the number of vaccines that they've developed, which are the Pfizer and the Moderna. We're still trying to develop even more due to the population we're trying to serve.
Indeed, and obviously, as many suppliers there are to the market, the quicker it will be able to be disseminated. That's just what whole logic in any industry. I will get to Mr. Young in just a moment, but I did want to follow up and maybe position this question to Dr. Wethers. So we know there are 2 vaccines currently, with the third on the way, and potentially more. These 2 that do exist, they require 2 doses. Are they interchangeable? Are they the same key ingredients? Is that something that might be able to, a person might be able to interchange the two doses? Dr. Wethers?
Such an important question, Jerry. You cannot mix the vaccines. If you receive the Pfizer vaccine, your second shot has to be with the Pfizer. If you receive the Moderna first, your second shot has to be with the Moderna. They are not at all interchangeable.
Got it. So again, if you start with one of the manufacturers, be sure to follow up with your same doctor with that same dosage, and obviously they will have a record of the product that you were given, which is a great thing that there are more than one supplier of this, because it should help dispel the idea that this is one large government conspiracy to infect the population. If there are 2 private companies producing a vaccine on their own time, own dollar, on merits. So,
Jerry, may I add that the greatest concern that I am reading about is that the compliance of the minority population. As you can see, there are 2 required vaccines. And there is a certain percentage in which I'm sure you'll ask that question later, that is expected of the United States to obviously have. But I think one of the greatest concerns that I'm reading about as far as with the minority population, because of our history, is that they, meaning the minority population, may not go back to get the second because they think their immune system has been built around that first one. So it's extremely important that, as pointed out from the doctor, that if you are going to take that first one, you must follow up with the second one. And you do receive a card, an immunization card, which you must keep on your person so that it can be recorded that you actually have that immunization, just like any other immunization you have received in the past.
And that part is interesting as well, because I think back when, I was in elementary school, and when I started school, I got my shots and had to show up with my card that listed, I couldn't read it because it was all scribbled, and my mother held on to it, but it listed out the vaccines and when it was taken. And that is just another idea that is floating around, that card tracking when you took the vaccine and what manufacturer it was is somehow your health pass to navigate through, will be your health pass to navigate through the United States, which I don't believe it would even hold logic, but that is just another challenge that those that are trying to get this under control is left to deal with. But Mr. Young, thank you for waiting so patiently. Definitely want to bring you to this conversation, particularly with it, talking about the distrust or the skepticism. Let's call it that, the skepticism of the vaccine. Maybe you can weigh in on your thoughts on what's contributing to some of the skepticism from the Black and Brown communities.
Yes, thanks for going in that direction. I think actually the hesitancy about any of this, at least within the Black community, goes all the way back to 1932 when they were conducting the Tuskegee syphilis study. They had 600 men, Black men from Tuskegee. 399 of them had infected with syphilis, and then 201 were not. And 4 years into the study, there was a paper criticizing the results of the study, actually saying there was questions as to whether or not the men were actually being treated as they were told. And even in 1945, when penicillin became the choice of treatment for syphilis, there still was concern that the Black men in the initial Tuskegee study were not getting the vaccine, the penicillin. And in fact, it was discovered by the United States Public Health Service that they weren't. So they involved about 127 Black medical students in 1962, I believe it was, to be involved in that study. And they were concerned still of the ethics involved in that whole program. And so the CDC got involved and actually was convinced that the study should go on and mandated that it continues, only to discover that in fact, I think it was 1969, that the study had ethics problems and it was discontinued. That ran rapid through the African-American community. And so a lot of people were concerned, in particular, fast forward to today, when there was all this concern between the CDC and President Trump's task force. It just raised the suspicion. And so that's where I think it began. But the truth of the matter is that science is science. And even in 1945, when penicillin was the treatment of choice, the problem was access. Did they get it? And I think that that's the same issue today. We might run into today. So I believe that we have to do an excellent job in educating the population about the myths, as we talked about earlier in the program, and really talk to trusted messengers, because the hesitancy is deep and it is real. And yet we know that if we are going to get this problem under control, we have to trust the science. We have to make sure that we have access to the vaccine.
So that great point, Mr. Young, as well as informing us of some of the history, because to be clear, the fact that there is skepticism, particularly within the Black community, for this vaccine or any sort of medical mass treatment, it's justified. It's within our history. It cannot be ignored. And I think if we are going to properly inform our community, as well as, quite simply provide them with information so that they can provide them with what they need to know to make an informed decision. Like, we need to address that. We need to acknowledge that skepticism is real, it's valid, but that doesn't mean that should prevent you from getting the medical treatment that you need. And this doesn't stop with the vaccine. Like, there is, I'm sure we got friends, family, community members that refuse to go see a doctor and because of that same logic, dating back to Tuskegee and some other incidents. So now we're asking, maybe this opportunity to be proactive. What can we do to help build trust for the vaccine within our communities? And I'll give everyone the opportunity to answer that. And I'll start with Dr. Wethers.
I think one of the most important things is what we heard from Dr. Allen earlier, that she already received the vaccine. I'm planning to receive it on Wednesday. If those of us who are in the medical community and are African American come forward and share our story of receiving the vaccine, what, if any, side effects we experienced, it may help to inspire others to follow and to give them more confidence that this is not something that will be injurious to them, harmful to them, or anything that they should be fearful of. We have a unique opportunity in that the federal government has done something right here. They are covering the cost of this vaccine. There is no cost to the recipient, other than perhaps an administration cost if someone has private insurance. And that dollar amount should be small. This is a unique opportunity for us to help ourselves, and we really should avail ourselves of it as best we can.
Dr. Allen?
Sure, and to respond to Dr. Wethers, the fee is extremely small, $19 to $38 just for the administration fee, depending on where you would go. I'd like to also go back to Mr. Young's response. That I love the fact that he presented dates of the Tuskegee study and other studies alike. A part of my job as a researcher is I focus primarily on a lot of human subjects. My primary job is with Alzheimer's disease. And now, of course, it's looking at more of the COVID entity. But one of the things that many of the community members may not be aware of is, as a researcher, we follow what is called IRB. And that's the Institutional Review Board, which was established back in 1974 for that very same reason that Mr. Robert Young pointed out, to help with identifying research concerns and protect the rights and welfare of the human being, the human rights as well. So if we, as a researcher, one of my goals is to always educate the community on what we're doing, why we're doing it, and how it's impacting the community. I do recall several years ago, I did a presentation and it was called We're Number One. And it wasn't a pleasant presentation. It was, we are number one in almost every health concern there is. And part of the reason is because we aren't as involved in research or involved in studies that will cause us to know what we can and cannot take. So I think just knowing your audience, to answer your question, Jerry, having a rapport with your audience, and that is a relationship. And then also educating, but educating them at the level in which they understand, not in a scientific format.
Sorry. And that is, quite frankly, part of what this program is providing, that both Dr. Wethers and Dr. Allen touched upon, putting trusted, respected individuals from our community to speak to our community. And we'll try our best to keep it in unscientific terms. Mr. Young, I wanted to turn over to you and ask, what can we do to help build trust for the vaccine, as well as medical procedures in general that tend to impact our community?
I'm really so glad you asked that question, because I do believe that while we can go back in the early days of, say, the Tuskegee study, for example. We know that that was a Jim Crow era where we were dealing with a lot of issues that, frankly, today we still are. And I do believe it's incumbent upon the various state, local governments who produce the policies and practices around health equity to stay in that study. And it's not just health equity, but it's also equity and justice, because I think those things go hand in hand. And what we need to do is to send the message that those policies and practices that are being implemented have been studied, they understand what the issues are, and are putting policies and practices in places that allow all demographics to have access to what they need to stay healthy in the era of pandemics. I think the other thing too is that we must educate the population around health practices. I don't think we can underestimate the responsibilities that we need to follow, or not responsibilities, but the practices that we need to personally follow to prevent ourselves from actually contracting the disease, but also to make sure that we are preventing others from being infected as well. So I do believe that there is a responsibility for these collaborations to really work together to go after some of these, I'd like to call them determinants of health that affect us all, but not just determinants of health, but also the determinants of living in a society where justice is questioned. So we need an equity at a study around health, and I do believe that we need to look at it through a lens of justice as well. So I think all of this kind of converges to working together in the areas where we can, as sectors of the community, making sure that we are eliminating the health disparities that currently exist.
And that's a great point and a great opportunity for us to segue to another topic I want to dive into a bit, and that is access. So Mark Morial, the president of the National Urban League, says, well, within the last year dealing with the pandemic, COVID-19 isn't the only pandemic that we're dealing with. Racial injustice is another one that has been around much longer and much more prevalently. So, and that leads me to the idea of access. And, if the Black and brown community even wanted to be able to get the vaccine, may not already having the resources, the influence, unfortunately, that is another part that may play into it, to even get access to the vaccine. So if someone wanted the vaccine, how difficult would it be for them to obtain it? And what is the hierarchy related to obtaining the vaccine? We know medical professionals, as logic would suggest, should obtain priority, but what is the hierarchy for other members of the community, both those underinsured and uninsured? And we'll start with Dr. Allen.
Sure. So one of the things that I really appreciate with Arizona is that they've established a hierarchy, and every state has a different hierarchy. We were able to establish our hierarchy, believe it or not, back in October of 2020. There was a draft that was put in place that if we got the vaccine, what would it look like in distribution? And so there is a AZDHS, as you all know, and this is part of the program. They have a phenomenal site in which you can navigate through that website, look at the particular areas in which they've created. Originally, Maricopa County created a hierarchy, and it was actually in a wheel form. I present COVID updates on a weekly basis, so I was utilizing that at one point. And then later, the AZDHS has established their own, which is a little bit more reader friendly. And so basically that actually identifies the phase format. Now the phase format goes from phase 1A, which we're in now, that's healthcare professionals. And that's why I was able to get mine as early as December or mid-December, 5 days after they've launched it. And it moves on to 1B, which is our older age population, 75 and older, and then 1C, et cetera, et cetera. And it goes all the way up into the latter part of the spring. Now, the one concern that I do have is the navigation and registering for those sites. And I'm sure Dr. Wethers would actually share a little bit more, but navigation is a little challenge. And so on a weekly basis, when I do my COVID updates this week, I'll be sharing with the audience and the community in which I serve how to navigate through the website so that you can register for the vaccine. So I'll hand it over to my colleague and see if he can share additional information.
Dr. Allen, thank you. I want to point out that everybody doesn't have computers or access. And so one way that people can register is by calling ADHS at 602-542-1000. And I'll repeat that, 602-542-1000. And you can be guided by a staff member in registering for COVID-19 vaccination. As Dr. Allen mentioned, 1A is for frontline healthcare workers, but also right now in 1A is an administration by the pharmacy community in long-term care facilities. So if you have a relative who's in a nursing home or long-term care facility, they right now can be immunized for COVID-19. That next group then will be other essential workers. Those might include school teachers, our sanitation workers, food service workers, other people who interact with the community, with the public on a regular and intimate basis will be in that phase 1B, as well as other essential workers as defined by the state and by the counties. We're now seeing the invitation to people 75 and older because we know older adults have a higher death rate from COVID-19, and we want to make sure they get covered. As I mentioned earlier today, ADHS and Blue Cross Blue Shield, along with the Walgreens Corporation, the and others, the Arizona National Guard, have partnered together in a 24/7 COVID-19 vaccine blitz out at State Farm Stadium, which will run for the next 8 weeks. There is a sign-up location for that as well online, and we're looking forward to immunizing as many people as possible.
So for those that watch the program all the time, this is a running joke. At least one time every program, I talk with myself on mute. It's without fail. It's a tradition at this point. So I was going to say, for those of you who can't see the website at the bottom of the screen, may not be completely visible at the moment, but the website to register will be available. We'll share it on the email blast and on the comment section as well.
Jerry, can I add a point that
Sure.
Dr. Wethers just mentioned a few minutes ago, and that is that this whole access problem for particularly populations in the Black and Brown community, they may not have transportation, as he indicated, they may not have computers and that sort of thing. This is why I think it's so important that we build partners, develop partners and collaborations like not-for-profit organizations who have really a window and an access to that population vis-a-vis just the services that they supply and make available normally. And so I do believe that there is a role for the entire sector, community sector, to come together and think about how do we close the gap to make sure that the gap for access, that is, to make sure that we are reaching the people who are not only most vulnerable for the disease itself, but who are least able on their own to get to the places to be vaccinated, to use and make sure that we have a registry or hotline or whatever it takes to communicate that message to that population, that there are other ways by which those services can be provided to assist them in gaining access.
Absolutely. Absolutely. And I can tell you here, we will continue to email. I'm sorry about that. So I know in watching the, you have any questions, we'll have an opportunity to ask questions earliest convenience. We will address them throughout the duration of the program, which is coming up in just a few moments. We do have a question to give our audience an opportunity to get their questions answered. So, and this was another question that was posed. Can you all not hear me? All right, Dr. Allen, it may be something with your speak. I think Dr. Wethers said he was able to hear me. Is that
Yes.
accurate? While Dr. Allen gets that together, if you're still unable to hear me when we get to you, just let me know. I'll hold off on any questions for the moment. But just to reiterate, a fact that if you whether you're uninsured or underinsured, that will not be prevention from you getting the vaccine. It's just a matter of the priority. So we do have a question from the audience. I did so the vaccine is to obtain sure that we can get the vaccine of the COVID-19. Dr. Allen, are you with us? All right, we'll go to Dr. Wethers.
Jerry, I'm sorry. Can you repeat that question? I wasn't able to hear from the echo.
We need to kind of correct things on the fly sometimes. Is there still an echo?
No, much better. Thank you.
Yeah, so I was asking here in the United States, is there a particular threshold that we need to gain, meaning the percentage of people to have taken the vaccine in order to get to it? And if so, what is that threshold?
The number I've heard is 70% need to be vaccinated in order for us to achieve that herd immunity that Dr. Dean mentioned at the beginning of the program.
I'm muted.
And with that, we'll be able to start to release some of the safety measures we've taken, such as the mask and the social distancing. But that's going to take us several months.
Mm-hmm.
Got it. So pause for a moment, just on the technical aspect. There is an echo coming from someone's microphone. So if it continues to present a problem, I will go ahead and control the mics. So until then, we'll kind of keep going as scheduled. But if I do mute your microphone, just go ahead and let me do that. Be the best way to control the echo that's happening. Wanted to take a couple of questions from the audience, and we'll start with Ashley Atkins, who is our Urban League Young Professionals president. And Ashley asks, if someone has already had and recovered from COVID-19, is it still as urgent for them to receive the vaccine? Dr. Allen or Dr. Wethers?
I'll take that one first, Dr. Allen, if you don't mind. It's still important for someone who's had COVID-19 to receive the vaccine because they may not have developed adequate antibodies when they got sick, not adequate to protect them long-term from subsequent infection. And so having had COVID-19 in no way disqualifies someone, and if anything, suggests that they really should take the vaccine because they've already proven themselves susceptible.
Thank you. And wanted to go back to Dr. Allen. Hopefully she was able to just check with your microphone, quite frankly. Are you still unable to hear us? Yeah, maybe some technical things happening on your side with the speaker. I did want to talk to Dr. Allen a bit about the research that she's doing and maybe some other areas that has dived into. But if we're not able to do that, we'll be sure to come back to you in a few moments. But again, out in the audience, if you do have questions, feel free to drop them in the chat. We are trying our best to make sure that all of your questions do get addressed by those who are most equipped and informed to answer those questions.
Jerry, can I pick up on something Mr. Young mentioned earlier?
Certainly.
He spoke about the social determinants of health and how they impact us in light of the pandemic. We know that Black and Brown people have passed away at higher rates, but there's also other things to think about. Very commonly, people who are overweight and middle-aged and have other conditions like diabetes, heart conditions, especially lung conditions like emphysema, also seem to have a higher death rate from COVID-19. So even though it's been talked about for decades, if not hundreds of years, diet, exercise, taking your medication, taking general good health, care of your health becomes even more important now.
And that's a great point. And I think that's one area that, unfortunately, I don't think received enough attention early on in the process. We heard, plenty of information about wearing the mask and, using sanitizer, washing our hands, but I don't think enough attention was given to the overall health of the individual and how we can take better responsibility in that area to, kind of help, just strengthen our immune system to combat the virus. Mr. Young, what do you think, if any, that was due to that? There just simply wasn't enough attention on that. Like, was it a matter of, not wanting to put undue pressure on the individual, or just relying on external resources in order for them to, to help combat the virus?
Is your question, what is the reason why the health equities were not addressed initially?
Yeah, as a matter of taking them, I guess, or some, why wasn't enough attention given to the individual to kind of improve health and immune system versus masking and disinfecting?
Yeah, I my own personal belief is that there was never really, it never really been, even before the vaccine, the advent of COVID-19, that there's always been a lag in addressing health disparities within the African American or the underserved community. And I think a lot of it had to do with the fact that there was no data or studies that was done to the extent and then communicated out to the population where this void was. And so we pretty much, like everything else, when you look at any disease, you look at any illness, you're always going to find who's going to be the population most affected, and it's a Black and brown community. So not a whole lot was done when policies and practice were being put into place around access, and also the whole health industry itself and how that operates. The policies and the practices didn't take into effect what some of these social determinants were that prevented this population from being healthy. And believe me, I think that now that we've had the experience of the pandemic, now that we are looking at who's affected and what those implications are for the society in general, we are going to start to see more emphasis being done on that. I know that the CDC has been doing a lot around health, social determinants of health, to include the demographic populations and the implications for that. So I just believe that we've been, that whole effort has been neglected. When we think about what the policies are coming down from the state and from the federal government around social determinants. And now we know what we have to do as we look at the impact on the demographics.
Thank you for that, Mr. We still Dr. Allen make every effort. We are coming close to time. So again, in the audience, questions, drop them in the chat. Hold up just a moment. I'm just scrolling to see if there's any questions I might have missed the rest. We from Zavala. How long will it take the community after the vaccine with the immunity? Dr. Wethers?
Thank you for that question. For each of the 2 vaccines which are currently available, the time to establish immunity differs a little. For the Pfizer vaccine, it's expected to be about 1 to 2 weeks after the last shot. So somewhere in that 28 to 35 day interval. For Moderna, where the second shot isn't taken until 4 weeks after the first, there's expected to be another 2 weeks after that, or up to 42 days before immunity is adequately developed. Now, that's based on lab tests where people were in protected scenarios and, by presenting themselves to be in the study, were motivated to show up for their vaccinations on time, et cetera. In the real world, where people may come a little early, may show up late for their vaccination, may not have been in the best condition when they received it, those numbers may not hold up quite so well. What we do know, though, is that the length of time for the immunity once established is unknown. We'll have to continue to monitor people long term in order to see how long they're able to demonstrate adequate immunity to either of these vaccines or to those which follow.
Again, this is an opportunity to get your questions answered. If you are watching the audience, if you do have any final questions, please bring them to the chat. We have a question from Jessica Raymond and asking if individuals need help scheduling an appointment, can they call the Urban League? And the answer to that is absolutely yes. If you need any assistance in navigating the portal to get registered a vaccine, you will be able to reach out to us. We do have a couple of volunteers available who can assist with navigating that. And I am pleased to announce that we have Dr. Allen back with us.
Using my phone. I don't know what's going on here.
We have you now, but we did open the floor to questions from the audience,
Okay.
and answer as many of those as possible.
Okay.
We are coming up close on time and definitely want to be respectful for your time, energy, and efforts and information on today's broadcast. So thank each of you greatly. Before we close out, definitely want to give each of you the opportunity to provide some closing remarks. And we're going to go ahead and start with Dr. Allen to make sure that we don't lose you.
Yes, thank you very much. And I appreciate you all allowing me to present today. As I've mentioned before, most of my research is in the community and the clinic. It's actually a connection of the two, providing data, informing the community on how to stay safe. It's interesting how we can show how to stay safe and maintain health, but it's even better when we provide numbers, data, statistics on why and what's happening to our great state. One of the things that I appreciate, Jerry, allowing me to briefly share, as I mentioned earlier at the beginning of the presentation, I am co-chair for the NIH All of Us Research for Arizona. And part of that position, I actually educate the community on how to get involved with the research. For example, we have a large number of our population, African American in particular. We are impacted with what is called sickle cell, which is a disease that actually has a certain sickle cell trait. Because the African Americans predominantly have that cell, we would be the ones that are more prone to do research to provide information on how we can combat that situation. So it's the same thing when it comes to COVID or Alzheimer's disease. We have to be more involved in research. Research does not always require drawing blood or receiving your DNA. It can simply be asking questions about your family history so that we as researchers can have a better understanding how to care for not only the community, but community that is of color. So this is so important to me. Unfortunate situations has caused us to get even more in depth with research, but it's so important that whether you receive the vaccine or not, you are well informed. And I love this panel because we are giving you facts, not fiction, and we're providing you only with the information that we have. And it's very limited because of the short term that this coronavirus has been out. Thank you, and I appreciate you.
Thank you so much, Dr. Allen. And I guess that's one point that we probably could have dived into a bit, is part of the distrust or the skepticism with the information being provided is that those providing the information didn't yet know at the moment either, right? It was just so new. It's a new thing to the world, and it's there was an explanation of this belief that if a doctor or someone from the government gave you this information, they should be certain about it. And I don't think enough grace was given to the fact that they just didn't know, or we just didn't know it. And it was a learning process, and we're still learning. We're still evolving. So that was a great point that you brought up. The fact that we just don't know, and you just got to trust that those that are in power, those that are doing the work, those that have been immersed in this field long enough, that they're giving their best effort to provide us with the information needed. And hopefully that will be enough to help build some confidence in the vaccine. I'll go ahead to Mr. Young for some closing thoughts.
Yes, thanks, Jerry. I want to go back to the point that I believe is still very critical, and that is that we should do everything we can do to make sure we can dispel some of the hesitancy in the viruses that are coming out and the treatments that are coming out for COVID-19. As I stated early on, the science is the science. The facts are the facts. And just like penicillin came along and some of the other vaccines have come along to treat some of these diseases, we have to look to science to help us. But if we can do anything, we can do everything we can to dispel some of the myths. I think that's well worth doing. The other piece of this is that I go back to some of these health disparities and health equity issues that we're dealing with, and I really am happy to see more and more collaborations are starting between the not-for-profit organizations as well as the state and local government, and the partnerships that are forming to make sure that the populations most vulnerable are being included in the strategies to make sure that everyone has access. I love the fact that they've taken away the economic issue around price, but we still have other issues that needed to be addressed, and many of those can be addressed by some of the partners within the community that knows these populations best. So I'd like to compliment the Urban League for creating a forum for that information to get out and these questions to be asked. So thank you very much.
Thank you, Mr. Young, for sharing. Dr. Wethers has some closing thoughts.
Thank you, Jerry, and thank you to Mr. Young for helping me frame my comments. Blue Cross Blue Shield of Arizona has a slogan that we're committed to improving the life and health of all Arizonans, not just those who are our members. In partnering with the Greater Phoenix Urban League and this program and in other work, we want to exhibit that partnership. In working with the state and getting the vaccines out to the community, we also are continuing that partnership. We are committed to seeing all Arizonans survive COVID-19, if at all possible. And we encourage everyone, wear your mask, perform the social distancing. I know it's hard. Wash your hands, do all of those things, because this is going to be a long haul. It will be months before enough people have a vaccine, even if everything goes well. So do your best to take care of yourself. Thank you.
Thank you, Dr. Wethers. Thank you, Dr. Allen. Thank you, Mr. Young. Our panelists, you have been more than gracious with your time, energy, efforts, and information on today's broadcast. Again, out there in the audience, the Greater Phoenix Urban League will be here to provide you with information that you need in order to learn as much about COVID-19 as well as the vaccine. So if you do not already follow us on social media, you can visit us or follow us at Urban League PHX, and on Facebook, Urban League _PHX, on Instagram. Go to our website, gphxul.org. You can sign up for our email list and become a part of our distribution list to receive continuous information, not only about the COVID-19 vaccine, but the other programs that are facilitated here at the Greater Phoenix Urban League. I want to thank you again for sharing your time. But before we close out, I want to bring back on once again the president and CEO of the Greater Phoenix Urban League, George Dean. Hey, George, I think you might be muted.
Okay, I'm sorry about that. Thank you so much for listening, and hopefully the information that was provided to you is something that's going to keep you safe. You want to get vaccinated. You want to you want to stay safe. You want to wash your hands. You want to continue to wear your mask. We have several challenges that's confronting us here as a nation, and certainly here in Arizona and in Maricopa County. And not only do we have COVID-19, but we got economic inequality, racial justice, crisis of the American soul, just a lot of things that's going on. So it's very, very important that we stay safe and so forth. Special thanks, very special thanks go to Dr. Wethers, Dr. Allen, and to Robert Young for appearing and providing our audience with the kind of information that is so useful and helpful and all. So thank you all very much, and we'll look forward to seeing you next month on Meet the Leaders Forum with the Greater Phoenix Urban League.